All right, so how do I do this? Anyways, it doesn't matter. So, anyways, I'm Twan. I like to boast on Dental Town. You probably see my name there. It's Fleegan Fishing. So, I assume you guys are all students. So, I read some of the questions that you guys have posted there. And so, I guess I'll just start going down this list. And if you have any questions or anything else that you want to ask, feel free to. Don't feel, I'm a laid back person when it at least comes to dentistry. So you're welcome to can you guys hear me? Why does it say, there we go.
Oh, we were muted.
Okay, yeah, I couldn't figure it out. I was like, what is going on here? Okay, you guys can hear me, right?
Yes.
Yeah.
Okay. So anyways, you guys are welcome to ask me questions if you want. You're welcome to interrupt me. It doesn't matter. If you want clarification on something, I don't really care. You're not going to offend me, so it doesn't matter. So I'll start with some questions that I see here. First one, it says, what can we do as students to increase our communication skills? Well, I made this quick little Dental Maverick course for students coming out soon, and they told me it's going to be starting editing this week. So hopefully it'll come up, and there's no cost. You just have to sign up with your EDU, and then it's nothing too in depth, but it's a couple of things that I wish as a student that someone told me so that I could start thinking about, because it's really true. When you get out of dental school, that's where you really start learning things. And in dental school, you have school for a reason. They teach you some outdated techniques and stuff, but the purpose of all of it is really to get you thinking about fundamentals, hopefully thinking systematically, and giving you the basics. But really, the real dentistry doesn't occur until you finish school. And that means clinical, and of course it means business, management, and everything, which we really have very little instruction in school. Like in my school, we had a course on practice management, but when I think back and I think back on what they taught us, it was unrealistic. We thought in school that our goal was to produce maybe our office $10,000 a month, $15,000 a month. That's unfeasible for today when we have all these loans, we have to buy all this equipment and stuff. It just doesn't work like that. Why does it keep muting all of you? Did you guys mute yourselves or?
Mm-hmm.
Okay. Anyways, I thought I was pushing some buttons or something like that. But anyway, so the first question is, what can we do as students to increase our communication skills? Well, I'll say as students, you have the ability to practice on your patients. So, I would say when you're in school, one of the best things that I learned as a dentist to increase your ability to have treatment plan acceptances is to start thinking about dentistry not as a dentist, but to start thinking about dentistry as a regular person, okay? We're technical. I can move my hand 1/4 of a millimeter now. I can look at things and I can tell if the margin's off. I just know. I mean, you do it so long, it's just so easy. But the problem is we start thinking too much like engineers. And one of the best things I learned is that there's only a few percentage of the population that will think like an engineer. And if they do, they will ask you for more information than they will ask you for the details. So you should not default on being technical. You should think about presenting why they should accept treatment in terms of stories and analogies, okay? And I learned this from another course, a PDA course. It's an excellent course when you have offices one day. It's a very motivating course. You should take your staff there because you see real life doctors, you hang out with them, you see successful, unsuccessful doctors. In my course, the real course, I just created the training portion for staff too, and hopefully it'll be motivating also. But PDA is a great course, but I lost my train of thought. But what I was saying is you should present treatment in terms of stories and analogies. Meaning that people don't. It's like, if you can help them paint a story in their mind about why they need dentistry, and they can imagine the process of what is happening. Oh, my tooth has a cavity. Then you can get them to accept the treatment even without asking them to accept the treatment. Like, for example, one of the things that, so think about an average person. If you were an average person and you came into the office like, doc, do I have any cavities? What's going on? You know, well, hopefully you will know, or you don't realize yet. As a dentist, there are many cavities that occur, but they don't hurt yet, right? It just doesn't. You can see them on X-ray. You see a class 2 lesion, and you're like, there's a cavity there, and it doesn't hurt. So patients are typically trained, just like any of us, to assume that if something hurts, that's when there's an issue. So one of the other things I've learned in my life that's very important is to always keep in mind, address the objection before it isn't, which means if you can imagine yourself as a patient, an employee, or anything like that, and you can imagine the potential questions they're going to ask you, you know, why is this, that, and you can answer it before they even bring it up. You sound like a genius. So for example, you have a patient that has a class 2 lesion, and they're like, if you don't explain it well, they're going to be like, this doctor's telling me I need 5 fillings and nothing hurts in my mouth. Well, that makes sense. That's what they're thinking. But if you could explain to them, like I explained to them, oh, you know, this is your enamel. You see all this pretty stuff when you smile. You look at my teeth. That's the hardest thing in your body. It's harder than your bones. In the middle of your tooth, there's a nerve. Well, when someone has a cavity, and the reason I take an x-ray is because if I can ask, unless you have a hole or you have a toothache, I ask you if you feel there's a cavity, you'll probably say no. And then I say, so when someone has a cavity, it starts at the enamel, goes through your tooth. There's a hole, there's a big hole, it's a black hole, probably didn't hurt yet until it's on top of your nerve. And some people, they've had root canals and stuff. So in their mind, they're like, oh, now I get it. I have a cavity, but it doesn't hurt. And it clarifies in their mind. If I have a picture that, sometimes I show an x-ray, sometimes I show a picture in the mouth. If it's a big hole, I'm like, see, you got a big hole. Still doesn't hurt yet. I asked you earlier if it hurts or not. And they're like, oh, now they're like, okay. So I'm proving to them that there are things going on, even though it doesn't have pain. I'm painting the story of, why something can occur. I'm explaining to them in easy terms. I don't say class 2 lesion. I don't say, this isn't a dent. I don't ever say any of that. Someone actually really asks me and they know something. I tell them, look, there's a cavity. It's like Pac-Man. It's going through your tooth. Now we got a hole. Now we got a bigger hole. It's going to closer to your nerve. Finally, it's on top of your nerve. It comes out of nowhere. It's like crazy. So when you're a student, you should start thinking about every situation, every procedure, and start thinking about explaining it in terms of stories and analogies. That's what you should do. You should spend your time thinking about that, and then, kind of keep a little log. Does this patient accept this or that or whatever? And then tweak them. If the patients don't understand, then whatever you're saying doesn't work. You sign up for my course, I got an 80-minute video or something like that, full of stories or something like that. But, there's, I've been doing this for years, and I've tweaked my stories. I'm sure there are people that have better stories, but they work well for me, and you may find something works well for you. So as a student, that's what I would do. Now, next question is, what is your goal here on Dental Maverick for students? Well, it's a short course. It's not in-depth like doctor course or staff course, but like some of these things I just told you. Students don't think about that. I didn't think about it. That was the last thing I thought about in my mind when I was a student. I was just focused on, I got to get my comps or whatever done. I got to do this. I got to do stupid lab work. That's all I thought about. That's all I did. But when you're a student, if you want to be the student that's ahead of everyone else, then you should start thinking about these things. You got to think non-clinical. Non-clinical is what makes you successful. People, you read people in Dental Town, and they'll make fun of me talking about communication. You don't need this or that. Well, that's fine. They just want to be where they're at. I'm a lazy dentist. I'm not lazy, but I work hard to be lazy. There aren't many, even Phil, the guy, Phil, that's wife is a dentist. He works 2 days a week. His wife works 2 days a week. But he still sees more patients per day than I do. I do 1.2 million a year, which I never knew what $1 million was. I didn't think about that when I was a student, but that's what I do. And I see 4 patients a day. Today I think I saw 4. That's all I did. And the only main things I did today were I did 1 crown and I did 4 fillings. I was like, I made good money today with my hygienists doing their job. So the way that I get there is I thought about, as a dentist, all these things. And so like I was telling you how to communicate, increase your communication skills, that's part of it. You got to think how to explain, because really the ultimate thing that you're trying to, I tell people, you're a dentist, but that's not your real job. If you can't get your patients to understand why they need treatment, Are you really a good dentist? Not really. You're sucky dentist because the patient has a hole in their tooth getting bigger and they think you're a dumbass because you're trying to tell them something they don't have, and they don't go to the dentist, and then it gets worse. And then one day they go to the dentist and they're like, "What happened?" So your goal as a student is to start thinking non-technical. Think about the psychology. Think about how to be a doctor that can get your patients to understand why they need stuff. You know, some people over treatment plan. You know, people think you over treatment plan because they don't have enough education to know why you do something. That's not the goal. No over treatment plan, but you know, if you are a good dentist, you can teach the patient why they need. So the next thing is, what advice can you give us about finding our own niche? Well, I think you're a student, and I don't think you'll find it yet.